Hey, welcome to Dictations. Happy Father's Day to all those fathers out there. I know I had a great day. I got to ride my bike with the family at the Creeper Trail. And today we're going to talk a little bit about, we're going to continue our men's health series. And we're going to talk about a sensitive subject with men. And I think one reason men are afraid to go to the doctor, the PSA and the prostate check. As you know, all men over 40 should have, in my opinion, a prostate check once a year and also a PSA. The prostate's a weird gland. You know, it's located surrounding the urethra, so the only way you can really feel it's by doing a rectal exam. And when you do that, you can actually feel 2 out of the 3 lobes of the prostate. You're still missing what I call the dark side of the moon. You can't feel that, but it still needs to be done because you can get a good feel for how large the prostate is, if it has any nodules on it that may be suspicious. You know, through years of checking prostates, it just comes with experience. And if you don't know what you're doing when you check a prostate, you shouldn't do it. You should send them to somebody who knows what to do. But in any event, it also gives you a chance to do a rectal exam where you could screen for rectal cancer, which is a bad form of cancer. But in any event, it's a real easy exam to do, especially if you have long, skinny fingers like me. But it's a little uncomfortable. It's not painful. But I think a lot of men don't go to the doctor's office because they're afraid of getting this exam. It really doesn't take, 5 seconds really to do it if you know what you're doing. It's a very useful test in a lot of ways. And, a lot of people just defer to getting the PSA, which is not a great test. It's a useful test in some ways, but certainly not a perfect test. I mean, through the course of my career, I've found guys with prostate cancer who had a PSA of 1, and I've followed guys with a PSA of 18 that had no prostate cancer. So you got to take both and kind of combine them and use your judgment on following what I call the velocity of the PSA. Anything, typically we say, well, if your PSA is under 4, you're okay. But really what I look at more is the change in the velocity of the PSA. So if it was 1 last year and this year is 3.5, you have to kind of perk your ears up a little bit and really dig after it just a little bit. Now, because there's the PSA is a really imperfect test. It can be influenced by a lot of things. One, of course, is in the large prostate. I know personally, I'm 65 years old. My PSA has been to 5.5. Now it's about 2. So it can vary a lot. So there's a lot of things that can trick it. So don't get freaked out, number one, if you have a PSA of over 4. It doesn't mean you have cancer. And, although a PSA of around the 1 or certainly less than 1 is reassuring, it should be, but it shouldn't be as a grant all that you won't get prostate cancer ever. What we're trying to detect in prostate cancer are those aggressive forms of prostate cancer. Once us men get around 90, we're all going to have prostate cancer. We're all going to die with it, not of it. So what you want to do is screen the people that you suspect may have an aggressive prostate cancer. So the PSA can be affected by a lot of things. One is if you have a inflammation or infection of your prostate, it can falsely elevate that PSA. And so can other things like recently having sex within a day or two. When you get the PSA, it may affect it, so don't do that. Lifting heavy weights, maybe riding a bike could also, I think that's what caused mine, can falsely elevate it. So if you can possibly do it, come in a couple days after having sex or riding your bike or lifting heavy weights. Prostate infections are fairly common too. A lot of times I'll see prostate infections, and sometimes they're bacterial, sometimes they're not bacterial. I think more of the times they're really not. They're more inflammatory in nature. Another reason to keep all the inflammation out of your body through the other things we talk about, like what you eat, gut function, etc. So the PSA, another thing that I do, I'll look at if I have a PSA that's kind of marginal, I'm a little bit worried about it, you got a normal prostate exam, but I'm not too worried. Sometimes I'll get a free PSA, and that is a measure. It's really a predictor of your chances of getting prostate cancer in your lifetime. And the higher it is, the better off you are. So it's a free prostate percentage. So that's one thing I look at. There's also some newer things like the 4K score and a few things that are really prohibitively expensive for most people that may delineate whether it's just probably a better test to detect prostate cancer, but it's not widely used because it's so expensive, and you've got to go to a research center to get it done. Although I've seen a couple guys for it, and it was a little bit useful to me. But so the thing that guys are worried about, they shouldn't worry about too much. It's an easy test. Follow your PSAs. It's not a great, perfect test, but it's still, it's very useful in that velocity of what it does. The fear a lot of guys have is that, well, my PSA is 4.5 or 5, and I'm going to be sent to a urologist. He's going to do a biopsy, which is probably true. A lot of the urologists are, because of the way they're trained, are going to do a biopsy. So a lot of times, which can carry its own risk in itself, like infection, etc. And plus, it's kind of a painful procedure, and it's not something you really want to get done, but sometimes you have to. But I like to get an MRI of the prostate. Not a lot of MRI machines have the technology to do an MRI of your prostate, and so it's hard. Like in Sullivan County or around here in East Tennessee, I have to send the people either to Chattanooga, Atlanta, or now UT Hospital, I think, does have the technology for it. And there's a few guys in the country that will do an MRI directed biopsy if we're real suspicious. In other words, you get the MRI, and if this expert, who all he or she is prostate radiologic examinations, that they can pretty much tell if you've got a prostate cancer. Then while you're in the MRI machine, they can biopsy that with a fine needle, which means a lot thinner, a lot sharper, less painful, with maybe 2 sticks rather than the 12 to 16 larger core biopsy truss needles that most urologists use. And again, that's not to down urologists. That's the way they're trained, and they're good at detecting prostate cancer with that usually, but it's a pretty invasive procedure. So if there's something better, and my idea about it is that in the future we're going to be doing a lot more of these MRI-directed biopsies. There is also an ultrasound-guided biopsies, which a lot of urologists will use, and certainly that's better than the blind biopsies. So there's a lot of advancement in this area. But you really, and even if you do have prostate cancer, a lot of it depends on what the score is. We have a thing called a Gleason score, and basically it's a measurement of how aggressive that prostate cancer is. If you have a Gleason of 6, which is defined as prostate cancer, it may not even really be a prostate cancer, so you can just observe that and do nothing. If it gets to be a Gleason of 8, 9, certainly you want to get more aggressive and look at your treatment options, which are several for that. So I see a lot of people that come to me for a kind of an unbiased opinion on what to do with their known prostate cancers, whether to observe it, whether to get robotic prostatectomy, traditional prostatectomy, proton therapy, brachytherapy, radiation seed implants. There's a lot of options, and it's something that really requires some thought and discussion. A lot of it depends on your age and your Gleason score, the size of your prostate, etc. But as men get older, they start having a problem urinating. So, and that's directly related usually to the size of their prostate. So that's another reason to evaluate the prostate with a prostate exam. So this is important stuff, guys. Don't be scared of the prostate. Just take it as something that you need to look at, because prostate cancer, kills about 30 to 33,000 men a year, American men. So you need to take it seriously. But I've found too that you shouldn't freak out about it. It's not something to fear and to forget about. I think that's one reason men don't come to the doctor as frequently as women. Men are more macho. They try to just ignore a lot of things. And compared to women are certainly more proactive with their health. So in the month of June, Men's Health Month, we want to educate men on coming to the doctor, screening, do a Cleveland Heart Panel, do a CT calcium, check your prostate. Do those things where we can prevent something from happening to you and give you some good advice on taking care of your health as you age. So I hope this is, very useful for you in talking about prostates and PSAs and coming to the doctor. So don't fear your prostate. Certainly you want your prostate to stay healthy, and there's a lot of ways to keep it staying healthy, like zinc and boron, and there's some herbal stuff you can take to help BPH, benign prostatic hypertrophy, and in other words, when you can't go to the bathroom very easily. So you can take care of your prostate and prevent things, certainly. Even your diet, I think, can prevent prostate cancer. So I hope this helps you, educates you a little bit on the prostate and PSA and the various things you need to think about. So I hope you have a great Father's Day, everybody, and come see us at Performance Medicine.